discharge nurse. Now, being a new certified nurse's aide, it's very intimidating. You're new to a facility, new people, and the patients, you have never seen them before. So you go in, you check on your patients after you get your assignment. You probably can introduce yourself to them if they're awake. Ask if they would like to get up for breakfast, and if they do, you would help them into the bathroom, wash their hands, face, put their dentures in if they wear dentures, and set up the ones that you can so they can have their breakfast. After the breakfast tray is passed and you feed the ones who need to be fed, you pick up your trays and then you start your day. You get your linens, towels, washcloths, adult briefs, get their clothing that they'll be wearing for the day if they are getting out of bed. Now, there are times when they have to go to a doctor's appointment out in the community, so you would get those people up early enough so that they can um, get to their appointments on time. And there are some patients who need physical therapy, so they too would have to be washed and ready to go for physical therapy. And usually they'll let you know who needs therapy. Now, in order for you as a new CNA to manage your day, you need to work at a pace where it's safe and you can get your assignment done in a timely manner. Now, you have breakfast and lunch to serve, usually on the day shift, which is 7 to 3. So, by 11:30, the lunch is getting ready to come on the floor, or the patients are getting ready to go to the main dining room. So, you have to work at a pace where you can get these tasks done, because you have to do some places, you have to do your vital signs, you have to pass fresh water. The lights are going off where different patients are asking to go to the bathroom. They need something. So, you have to work at a pace. It's hard work. You're on your feet a lot, but it's doable. And at the end of the day, it can be a rewarding job. Now, with a job like that, most people, they do go to school. It's usually about 3 weeks or a month. It all depends. So they do get training on how to take care of people, but it's not the same as when you're in a nursing home or skilled nursing facility, working with anywhere from 8 to 12 patients, because that can happen. It depends on what state you're in. You may end up with 10 patients on the day shift, but some of them are not total. They can assist themselves. You just have to be there, watching, making sure that they're not going to be falling on the floor. So that's how most of the assignments are broken down, where you may have a total of 10 or 12 patients, but out of the 10 or 12, they may have 6 that's full care, where you do everything for them, and the others, you just set them up. You go in and you can pretty much go from room to room and watch the other ones that you have set up, so that they can either, not in the shower though, don't ever leave anyone in the shower by themselves. Let them shower themselves, but you'll be right there in the room waiting for them to ask for help. So, because if they try to get up, something falls on the floor, they want to get up, they can fall. The floor is wet. So, never leave a patient in the bathroom or in the shower by themselves and unattended. Even though they say, oh, I could do it myself, stay close by, okay? So, your day is usually busy. So, by the time 2 o'clock rolls around, you should be pretty much wrapping up your day, finish up your charting. So, as far as charting, don't wait until the end of your shift to chart. Yeah, try to document as you go. After each patient, you document whatever task. Say it's breakfast. Make sure you go ahead and document how much percentage they ate. You give them a bath, bed bath, you shower, you document all of that, because guess what? At the end of the day, you don't want to try to hurry and do it because you're going to miss something. And the director of nursing, they'll come after you and tell you, or the supervisor, and tell you didn't do your documentation. So you want to do your documentation, because it is said that if it's not documented, then it wasn't done. So try and do your documentation, pass fresh water, do your afternoon rounds where you check on your patients, make sure that they're clean and dry, they're not on the floor. I mean, the nurses do that too, make sure the patients are safe. Always ask for help, especially if you have to use a mechanical lift to get the patients in and out of bed. Don't try to do it by yourself, because if they fall, you're going to be liable. So just remember, if you're brand new out of school, you definitely need some help in doing this job. If you're new to the facility, that's a different situation. But even if you're new to the facility, different nursing facility has different rules. So even though you have experience, try not to do um, your transfers with a mechanical lift by yourself. It's a two person transfer, so you need another CNA or you need a nurse to spot you. So just try and remember that. And you'll need someone to help you, either to turn and reposition someone, especially if they're so contracted or if they're really on the larger side. You will need someone to help you so you don't hurt yourself. You can work as a CNA for a long time. You can work in different areas, such as you could work in a clinic, you could work in a doctor's office, you can work in a hospital, assisted living, you could work in a SNF, you could do private duty. So once you have your experience, you could do pretty much whatever you need to do to make your life better. You can work on the weekends, bailiff shift, most places, that's what they call it. I'm not sure if they're still available, but most people will do Friday single shift, then Saturday and Sunday a double shift, and that's pretty much the 40 hours for the week if it's a 40-hour work week. And especially for single moms or women with children, it's so convenient as a job for them to be able to work in the morning and pick up their kids and be home with their children in the evening, or working at night, overnight shift from 11:30 or 11 to 7 while their kids are asleep. Someone of course is home with them, but it's flexible in that aspect where you can do whatever you need to do to achieve going to school, working around your children's school schedule, because that's something that I did. So I know it's doable. And being a CNA, you can work the weekend, you can work off shift, where most places they don't really have the off shift. When I say off shift, the 3 to 11, 11 to 7 shift. So most places, you go to work from 9 to 5, or from from 8 o'clock to maybe 9 p.m., and that's it. So you can always get overtime, which is can be very good. You get time and a half for overtime, and you can actually have a good paycheck at the end of the day. So I mean, I'm not saying that's what you should really do it for, just for the paycheck, but it's an incentive. So being a CNA in 2023, it's something that is doable, and I applaud anyone that is coming in as a certified nurse's assistant. We need you. and the healthcare field need you. And we appreciate the hard work of anyone who is a CNA, because I've been there, so I know what it's like to be a certified nursing assistant. Thanks for listening.